to go. Now today we'll have an update on our coronavirus trends and metrics from Dr. Mandy Cohen, our Secretary of the North Carolina Department of Health and Human Services. As she'll show, most North Carolinians are doing the hard work to improve our numbers and trends. Many people are wearing masks, keeping social distance, and being careful to protect others as well as themselves. We have shown that listening to the science works, and I'm proud of our resolve. As a result, our key numbers have stabilized or even decreased in some instances for a sustained period. This determination has slowed the spread of this virus. It's kept our hospital capacity stable, and without a doubt, it has saved lives. It has also put our state in position to move another careful step forward in a critical area, schools. Today I announce that North Carolina public school districts will be permitted to choose option A for their elementary school students only in kindergarten through 5th grade. As we laid out this summer, option A continues to include important safety measures like required face coverings for all students, teachers, and staff, social distancing, and symptom screening. But Plan A does not require schools to reduce the number of children in the classroom. Students in grades 6 through 12 still must operate only under option B, which is partially in person and partially remote, or option C, which is all remote. I want to be clear. Plan A may not be right at this time for many school districts and for every family. Opportunities for remote learning need to be available for families who choose it, and districts will have the flexibility to select a plan based on their unique situation. We're able to open this option because most North Carolinians have doubled down on our safety and prevention measures and stabilized our numbers. The science of lower viral spread among younger children also backs up this decision, which Dr. Cohen will address further. I'm proud of our work to get to this point and know that a number of school districts are moving soon to in-person instruction under Plan B with strong safety measures. We anticipate more will join them. Of all the disruptions COVID-19 has created, education is the most challenging to address. As the school year has started, I know that many parents are facing difficult choices and nearly impossible balancing acts between work, other obligations, and dealing with their children being home. Parenting is hard enough without a pandemic. Same goes for teaching or running a school. Our teachers, principals, and school support staff are doing more than ever, and we want to make sure that all of these options are safe for them. The number one opening priority during this pandemic has been our schools, and our continuing progress in fighting the spread of this virus is allowing us to do a little more. The more people wear masks and act responsibly, the more we slow the spread of the virus, and the more children we can get safely in our schools. I appreciate all of the parents, teachers, superintendents, school staff, and more who've worked to support our children at this critical time and to keep them safe. We've also communicated and worked with Eric Davis, who is the chairman of our State Board of Education, and Mark Johnson, the superintendent of public instruction, to help get us to this point. With that continued effort, we could do this the right way for our students. Now I'd like to ask Dr. Cohen to present the data and to speak more about today's announcement. Dr. Cohen.
Well, thank you, Governor. I'm so appreciative of your steadfast leadership and your commitment to science and data-driven decision-making. So let's dive right into the data. As a reminder, every week we look at a combination of trend metrics: COVID-like syndromic cases, lab-confirmed cases, positive tests as a percentage of total tests, and hospitalizations. Some of these indicators are timelier than others, but together they give us a picture of where we are today. With our first graph, we look at people who come to the emergency department with COVID-like symptoms. This is the most timely data we have, and it's our earliest detection mechanism. Taking a look at the yellow line, you can see that it continues to decline. This is a positive sign. But you can also see that this line is still high above its baseline. And we know that our baseline generally starts to tick up in the fall as flu season begins, putting more stress on our hospitals. So it's extra important this year that you get your flu shot. On to our next slide. We look at confirmed cases. This first graph on cases gives you a look at the trajectory of new cases each day since we had our first case back in March. You can see our peak was back in July, and then we had a bump in cases in August, coinciding with universities and college opening, and now you can see that that yellow line is going down in the last couple of weeks. So let's zoom in to get a better sense of the current picture. On this graph, we're looking at that same case data, and you can follow that yellow line. You still see that high in July, and then that bump towards the end of August, and then you see that line decreasing over the last couple of weeks. But we're still seeing 1,000 plus cases a day, and today, as the governor said, we had 1,500 new cases. To get to that continued downward trend that we're looking for, we all need to double down on those key preventive steps, especially wearing a face covering over your mouth and your nose whenever you are with people that don't live with you. Next, let's move on to the percent of tests that are positive. You've heard me say that I want to see this number closer to 5%. We are now seeing days where we are meeting that goal, and we need to keep that up. This is an encouraging sign that tells us the steps we're taking to reduce viral transmission in our community are working. Thank you. On the next slide, we also see progress in steady decline in day-over-day hospitalizations. We continue to have sufficient hospital capacity, so positive news. All right, so here's where we are. Our surveillance data is continuing to decline, though it remains elevated above its baseline. It gets a yellow line. North Carolina's trajectory of confirmed cases is declining, but the number of new cases is still too high. It gets a yellow line. North Carolina's trajectory in percent of tests returning positive is declining, which is a great sign, but it gets a yellow line. And North Carolina's trajectory of hospitalization is declining, although higher than we want to see. Again, we continue to have enough hospital capacity. Again, gets a yellow line. All right, now onto our capacity indicators. We're seeing real progress on expanding access to testing. We are deploying no-cost testing events across the state, and testing turnaround times have really improved. Testing is moving in the right direction. We have more work to do. On contact tracing, we continue hiring contact tracers to bolster the efforts of our local health department. And next week, we'll be launching our new exposure notification app. On PPE supplies, we remain stable. We continue to distribute that PPE across the state. However, we are concerned that FEMA has now put in new restrictions and is now only funding PPE for healthcare workers, when we know there are many other essential workers who need these supplies. So that's where we are today. All of this data shows that we are on the right track, and we see similar positive data when we look at young children. Since school started about a month ago, we've seen 10 school clusters across the state involving a total of 16 students and 46 staff members. In the last 2 weeks, we've seen the case numbers for school-age children decline, a trend that is particularly strong amongst our younger elementary school children.